So hi, my name is Debbie Alish, and I want to take a moment to welcome you to our Simulation Center. We are so excited that you're going to be joining us this semester, and there's a couple things that we want to talk to you about so that you feel a little less stressed when you come. When you come on your day of simulation, if you'll look in the ante room going into the Sim Center, you'll see a whiteboard, and on the whiteboard has a day listed, who the instructors are, and what room that you've been assigned to for the day. That's where you're going to be meeting your instructor. So that'll get you a good start for the day, and you're not wondering, oh my gosh, where am I supposed to be? I'm going to be late. None of those kind of things. The other thing I really wanted to take a moment to talk to you about is a little bit about the purpose of simulation and what we're trying to achieve while we're here in simulation. The purpose of simulation is to provide all of the students a common experience, so that if you go and you come in and we have a patient with pneumonia, everybody gets a similar experience. And that way, when you're getting ready to test on that concept of whatever we're talking about in class and you've simulated it, you test on it, and everybody has common knowledge because you've all done a similar kind of case. When you go into the hospital, I really can't provide those kind of situations for you, and I can't guarantee that every one of you is going to have the same kind of patient that you're going to see. Simulation allows us to provide a realistic, immersive learning experience for you. And by doing that, you get to go into a setting that is very similar to a hospital setting or a home setting, or even an urgent care kind of setting, where you actually are put into that situation and you get to be the nurse. Oftentimes when you're in a clinical setting, you have another person that's with you, and they are a nurse that's there, and you have someone that you can rely on that's kind of guiding you through the day. When you're in simulation, you are the nurse. You're the nurse. It's helping you to develop your clinical judgment, your critical thinking skills, and allows you to get some confidence that you're going to be the best nurse that we can possibly have come out of State College of Florida. Okay, so the other thing you need to know about simulation is that it is a safe learning environment. Everything that you do in simulation is confidential, and we have what we call the Vegas rule of simulation. What happens in simulation stays in simulation. It is between you and whoever your partner is and your faculty member, and whatever happens in the room, and it stays in the room, and only the three of you know what's really going on. So it's a very safe learning environment. There's nothing punitive about simulation. We don't give grades. We do expect that you come in and you're prepared and ready for the day. That is the purpose of all the pre-work that we give you. The pre-work gives you an idea of the kind of disease process that person's going to have. It'll talk to you a little bit about what kind of medications you might be seeing during the simulation. And the other thing it does is any skills that you might need to have to perform during the simulation, you're able to look at up ahead of time so you can refresh your memory on it. We never ask you to perform something in simulation that you haven't already covered as one of your skills within your level of nursing that you're doing. The other thing that you need to know about simulation is how the day is going to go. What is that day going to look like? Because I know that people get a little bit anxious when they come in here. So in the morning when you come in, you'll meet with your faculty, and they will talk to you a little bit about what happened, what you did for your pre-work coming in. And it kind of refreshes everything in your mind. You'll come into the Sim Center, you'll get report from the off-going person. Typically, it is the face of your faculty. Then you'll go in, you'll knock on the door. Hi, my name is, I'm going to be your nurse today, and the scenario begins. And in that scenario, which usually lasts anywhere from 20 to 30 minutes, there are certain objectives that we are wanting you to achieve. Once you've achieved those objectives, the scenario is then over. And then once you're completed with that, then you're going to go with your faculty and you're going to go to a quiet area where you can sit down and you can talk about the things that happened during the simulation. Typically, it's about all the things that you did really well, because believe it or not, there are a lot of things that you do really, really well. Then there are some things that maybe you could do a little bit differently the next time. Once you've had that discussion and kind of review the scenario and everything, then you'll come back in, you'll do charting on that particular patient, and then we ask that you complete a survey. And then with the second scenario, it's very similar. It's just a repeat of what you've already done in the other one. So that is what your day is going to look like in simulation, and we're so excited that you're going to be joining us. So one of the things that we have are medicine carts that are outside of all of the patient rooms. In the medicine carts, or on top of the medicine carts, you'll find a binder that has all your information that you need on your patient. It'll include your report, it includes your medication administration record, and it also includes any doctor's orders that are there. If you look in the drawers on the medicine cart, you'll find any medications that you might need for the scenario that you're doing. Supplies, if you need extra supplies, we have a supply cart that has all of your syringes, your needles, any IV tubing, alcohol wipes, and everything are all in this general location. So the doors are all sliding glass doors that you can open all the way, roll into the room, to your patient's room, to see what's going on for the day. As you come in, the light switches are located on the wall on either side of the room, and there is a place here that has hand sanitizer so you can wash your hands when you come into the room. In this room, we have on the wall gloves, so that if you need to have gloves for your patient, then you would put those on as well. And you'll find in the corners of all the rooms that we also have a cart that has all the supplies that you might ever need for whatever you're doing in the scenario. And so you won't ever have to leave to go get anything. Everything is here and ready for you. So in the room itself, you'll see that it looks like a regular hospital room in here. You'll notice over the head of the patient that there is a head wall unit that's there. And this head wall unit has several things that it can do, and it functions very similar to the head wall units that you find in hospitals. To the far right, and in the green, is your oxygen supply. It's not real oxygen, it's compressed air, but it does work, and you're able to go up and down. So if your patient needed oxygen, you come in and you would turn it on the same way that you would use oxygen in the hospital. The next flow meter over is yellow, and that is just nothing more than medical air. And if we were using it for nebulizers or something like that, that's the one that you would use. Next to that is suction, in case your patient has an NG tube or needs to be suctioned. That functions as well. All of the patients also have call systems that are located in the room. We have the ability, and they do work, so that if you were to push a button for an emergency, you would push it and it would go off. If you wanted to call a code, for instance, you could also push the blue button and it will alert, so there's a code. There's a cancel button, and you could cancel any of the calls, similar to what you would do if you were in the hospital with them. And so that is your head wall unit. And next we go to the bed and how the bed functions. You notice that the bed is currently, with the head of the bed a little bit elevated, and we know that we want to have our patients be all the way down when we're done with them. However, if we're going to be working with them and trying to do medical interventions of any kind, we want to make sure that we bring it up to at least a waist level so that we don't ruin our backs. As we get older, you'll appreciate the fact that you took the precautions when you were younger. So if you'll look here on the side of the bed, you'll notice that there's a little drawing that's here that shows the head arrow going up, head arrow going down. So if you were to push this, the head of the bed goes up, push the down button, and it goes down. Same thing with the feet. So there's an arrow that brings the foot of the bed up, another one that brings the foot of the bed down. And then one where it shows just the bed, the whole bed itself, that brings the bed up and brings the bed down. The other thing you need to notice is that there is a way to make the side rail go down so that you can get closer to the patient whenever you're doing anything. So if you push it in and you roll the side rail back, that gives you easier access to the patient. And so when you're done there, you just pull it back into an upright position. So now what we're going to do is we're going to take a look at all the wonderful things that the mannequins can do. And we'll do this similarly to what you would do as if you're doing a head-to-toe assessment. And the mannequins can do a lot of unique things, and the nice thing is that pretty much everything that you and I can do is similar to what they can do, or at least they can be programmed to do. You'll notice, and maybe you can't see it from there, but this particular mannequin is actually blinking. They blink. In some of the rooms we have mannequins that have LED eyes, and they can follow you, so they kind of track you around the room. It's a little creepy, I know, but know that that's what they do. If you were to shine a light in their eyes, their pupils do respond to light that is in the eyes, and we can change that to match whatever disease process might be going on with them. As you move on down, you can see that they have, ears and nose and teeth very similar to what you would have in a regular person. The teeth on some of them do come out. Some of them you might notice that there are little openings that by the nose, by the eyes, and by the mouth, and those are areas where secretions can be loaded into the mannequin so that they can mimic things like tears or drainage or drooling, so we have that ability. As you move on down, you'll notice, if you can tell or not, but the patient does have chest rise and fall. So they have heart sounds, breath sounds, lung sounds, and bowel sounds, just like you and I do. And we can program those to match whatever the disease is that we're talking about for the day. My suggestion to you is when you are listening to your patients, that you might want to take your stethoscope and strongly suggest that you listen under the gown. So you would listen to all the lung fields under the gown on the anterior part of the chest. Now, you can listen to the back. They do have sounds on their posterior side. However, the mannequins are very heavy, and we recommend that you don't roll them over or sit them up to listen to those. Just acknowledge that, yes, I've assessed that part. As you move on down, they also have bowel sounds. So you would listen to all four quadrants to be able to hear what the bowel sounds were. They have genitalia the same as whatever gender we're trying to portray in the scenario. We have female and male genitalia. Sometimes they can be interchanged, so make sure that you take a look at that. They can have catheters inserted so that you can have a Foley catheter with urine that drains out. They can have NG tubes, but because they don't really have stomachs, the NG tube can be in, and it's a simulated NG tube, and we can simulate things like gastric secretions and things like that. They also have, everywhere that you and I have pulses, they have pulses. The interesting thing about the pulses is, and it could be similar to what you see like on humans as well, if you get anxious or nervous as you're trying to feel a pulse, or if you push too hard and you occlude it, you will occlude the pulse and you won't feel it. So you really got to be patient with it. Just very gently lay your hands over it, and you'll notice that they have very good pulses in all their extremities. So they have radial pulses, they have brachial pulses, they have carotid pulses, they also have femoral pulses, they have popliteal pulses, and they have very nice, as I drop things on the floor, dorsalis pedis pulses. Now the beauty of all this is that we can change this to mimic whatever it is that's going on with the patient. So say for instance your patient has a really low blood pressure, they wouldn't really be perfusing very well to the other parts of their extremities, so you may not have pulses in radial pulses or your dorsalis pedis pulses, and that would be normal. So these mannequins are what are called physiologically modeled, so they follow that. So you'll notice some of the times when you go into the room that your patient has an IV that's running in the room. First of all, there's usually a pump and it's usually running, and at some point in your nursing education you'll learn how to operate the pumps and turn them on. But the object is the fluid is actually running and simulating an IV on the patient. You'll notice that it is usually secured with dressings. But there's also this other piece that comes out of it. This is the drainage bag, and yes, it does look like an IV bag. However, it's a drainage bag, so please don't hang it on the pump because it's meant to collect the fluid that's coming to us from the IV itself. So that is normally tucked underneath the pillow. Also, all of our patients have ID bands on them because one of the things that we want to do when we first come into a room is to identify the patient. So you say, "Hi, my name is Debbie. I'm going to be your nurse today. Could you please state your name and date of birth?" And as they're telling me their name and date of birth, lo and behold, I have a band that I can look at that has her name and date of birth on it, and we can verify that this is the patient that we're wanting to take care of for the day. Okay, so one of the things that you'll notice when you come into your patient's room is that they all have this monitor screen that's next to me here. Yes, I know that you probably don't understand all the pieces that are on the monitor, but one of the things that you'll be able to do throughout your education is start to identify more and more pieces of that. You'll notice that there's a heart rate, there's a blood pressure, there's an oxygen saturation, and a lot of times there's a temperature that's here. And those are all what she is currently experiencing at the time. However, that does not mean that we don't want you to actually take the vital signs of the patient. So we want you to actually count respirations, count a heart rate, make sure the radial pulse matches whatever you're getting for an apical pulse. So the monitor is here, and keep track of it as you're going along, because sometimes as you go through the semesters, the patient becomes more complex and there are changes that are happening. So watch this for any trending that you're going to see with your patient. So one of the things that you might notice as you are caring for your patients is that sometimes they've had a mishap of some sort, or they've had a recent surgery, and you may see things like bruises that are on your patient, or maybe a dressing that's on your patient, or maybe they have a Foley bag with a bunch of urine in it. Any of those kind of things are things that we make to make the scene be more realistic. We're asking that you don't discard them, because that means we have to make another one. And so they're there for you to add realism to the scenario, but they're not meant to be thrown away. So in the course of a scenario, you sometimes have things that you use during the scenario that we're asking that you don't throw away. There may be syringes. They can be the big syringes or the little syringes. We have all kinds of caps. There can be the purple caps that go on the medications. Maybe they come off the IV bag itself. We're asking that you don't throw them away, because we actually use them again. So what you'll find in most of the rooms is that we do have a plastic container, and we're just asking you to put those in there so that we can reuse them. Dressing, sometimes if you change a dressing, just put it to the side, and that way we can reuse our supplies, and it helps us to be a little bit more cost efficient with everything.